Here is your stem. One is just 2 lines. Once you've read, please tell me. I'll move on.
Yes, ma'am.
Yes. So here is one.
Yes, ma'am.
Right. Yes, next.
Okay, ma'am.
Right. So if you've read and understood, considering it communication skills station, please begin.
Hello, I am Dr. Mahmood, one of the surgical doctor. Can I confirm that I am talking to the trauma consultant?
Hello, Dr. Mahmoud. Yes, I am the consultant for today. Summarize your case, please.
Okay, sir. So we got a young boy who came with a history of road traffic accident. He's hit by a car while he was riding the bike. And then he came with initially unconscious, but on arrival to casualty, we found the GCS is 15/15. The patient was having bruise on the abdomen, and he also has open fracture, tibio-fibular fracture. So we did some investigation. So the blood investigations, all of them are normal except raised CRP. And the patients, we have done some imaging. X-ray shows left tibio-fibular open fracture, and we did ultrasound, which shows some free intraperitoneal fluid. So, and now the patient developed extremely cold and pulseless lower limb. So, my concern is the patient might have blunt abdominal trauma and vascular injury due to open tib fib fracture.
Good.
Okay, Dr. Mahmoud, who's the consultant for this case?
Okay, so is Mr. Mann is my consultant.
And where he admitted this patient? He is in ER or admitted to the ward?
The patient is still in casualty, so we didn't admit. Now, as the patient is
Okay, Dr. Mahmoud, can you tell me what's the most urgent? Is it the leg or the hertomy?
okay, so now at on examination, the abdomen is normal, no peritonism, and patient is hemodynamically stable. So I think the vascular injury, like as the patient is having pulseless limb, so this is most important for me.
What's the pulse? What's the cause of the pulseless leg? But you said
So I
his
think as the
pulse.
patient is having a open tip fib fracture, so either could be a vascular injury or maybe kinking of the vessel, or
What
could
else?
be compartment syndrome, though is less
Okay,
likely
Dr.
as the
Mahmoud,
patient is having open fracture. Sorry.
can you tell me what is the missed in investigation in this patient?
So we have to do a duplex ultrasound, or
Hmm?
as the patient is stable, we can do CT scan head, CT scan abdomen, and CT angiography of
Okay,
the
Dr. Mahmoud,
limb.
is your patient wearing a C collar or not?
The patient, okay, I didn't check it. Sorry for that. I will see the patient when I'm done talking with you. Then I will get back to you after that.
Okay, what you will apply for his neck?
So the patient, we can do cervical immobilization with heart collar. If he's not available, then we can put him on sandbag and tape.
Okay, is the patient dehydrated?
The patient is a bit dehydrated, but the hemodynamically is stable.
Okay, if the patient came to your ER, how you will manage this case?
So, okay, in that case, as we suspect the patient is having a open TP fracture and vascular injury, I have to do reduction first, and then I will do immobilization, maybe
No, I
by
am asking
putting a
you
back
how you
slab.
will manage the patient, not the fracture. How you
Okay,
will
so I will
manage the
manage
patient.
the patient according to the ATLS
Okay,
Advanced
good,
Trauma
good.
Life Support
Okay,
Protocol.
good. Dr. Mahmoud, can you tell me the plan of action now, for now,
Okay,
for
so
this
for now,
condition? Yeah.
I will reduce the fracture and then put a back slab to immobilize. And
Okay.
if the wound is dirty, I will just put some bandage, and then
No,
I have to.
regarding vascular, you said he is vascular. What you
Yes.
will do?
So now we have to order at least a Doppler ultrasound,
Okay, and you
and
see
then
is a vascular injury. What you will do?
so we have
Oh,
to call the vascular surgeon
yes, and what else? What
and the
you imaging
orthopedic
you will?
surgeon and inform my consultant as well.
What image you will do other than
Uh,
ultrasound?
Other than duplex, we can do CT angiogram or maybe MR angiography.
Okay, good. Also, you will do for his abdomen and pelvis. Okay,
Yes,
what
we
to
have
do
to do.
before?
We have done already the ultrasound. Then we have to do a CT scan head and CT scan abdomen
Okay,
with contrast.
what to do before sending him to the theater?
So we have to talk to the relative about the condition and the
Yeah.
prognosis.
No,
Then we have.
management before.
So management, I will go through ABCD protocol. I will check the airway. I will talk to the patient. Is he able to talk or not? Then I have to check the breathing.
Okay,
Is breathing well?
You will give him IV fluid, analgesia,
Yeah.
and
Then I will go
antibiotic
for
introduction,
circulation.
and cover the wound, right?
Yes, ma'am.
Okay.
So
Also, you will give him antitetanus. Don't forget to give him antitetanus, okay? Because he is open fracture. If
yes.
you called vascular and he said to you, getting ready, what you will do during this period?
So if he's busy by this time, I will
No, he is
do.
ready. He is ready. He is ready, and he
Okay.
will come. He said to you,
Okay. So
30 minutes, I
then.
will be in the hospital. What you
Okay,
will
then
do?
I have to inform the theater, the anesthetist, and then I will talk to the relative to take a consent. Then we will prepare the
No,
patient for theater.
for the fracture, what you will do for the fracture?
So we have to do reduction and then we will do
Yes.
immobilization.
Good.
Okay. What you will do for the one?
For the wound.
For the
What you
wound,
will do?
so as we plan to take the patient to theater, I will inform the orthopedic surgeon. Then the patient should be debribed, and if the wound is dirty, we have to debribe the wound and wash out in theater.
Okay, I also you will give antibiotic and you call plastic
Yes, we
surgeon.
have to
Okay.
give antibiotic
What?
and inform plastic
Okay.
surgeon as well.
Where you will debride the wound in the ER on the operation room?
No, in the theater.
Okay. What blood investigation you will send for
So
this
we have
patient?
sent FBC, UNE, and cross-mass and asked the lab to prepare at least 4 units of blood. And we
Okay.
did
So
CRP and ABG as well.
how you will fix the fracture?
So we have to do a external fixation as the
Okay.
patient is having open fracture.
External, not nailing or a plate?
Because as the patient is having open fracture, so if we put a intramedullary nail, it might be infected.
Okay. What did the GS ask for ultrasound and they felt the abdomen was normal?
So,
Why
sorry?
the abdomen?
Yes, general surgeon.
Why the okay? Why the ultrasound is normal?
No, the ultrasound shows some free fluid in intraperitoneally. So I thought could be patient having a blunt abdominal trauma. So we have to do a CT
Okay.
scan to rule out any organ injury or not.
People may need to call intra-op. Who will involve in this operation? The patient have
So,
abdominal
Who would you involve?
collection.
so we have to involve my consultant, surgical
Okay.
consultant, and then I have to involve anesthetist as well, and maybe ITU register.
What else?
Who
For
else?
vascular, for
As vascular surgeon, orthopedic surgeon, and plastic surgeon.
And a general surgeon as well.
Okay. Why plastic?
So patient as having a open fracture, so you might need to close it He
And
might
why
need a skin
GS,
graft.
why we should, if we don't want to operate his tummy abdomen, why GS should come in this case?
General surgeon will operate, do laparotomy. And
Okay,
if there
also
is any
the,
organ injury,
also
to fix that one.
also compartment syndrome. Okay, management of
Yeah.
free fluid in abdomen, emergency laparotomy, patient metacarpal fracture. I think it's no. Okay, I finished. There is no metacarpal.
Good.
Okay,
I
thank you,
think now it's all covered. Very good. Well went. Very good. Excellent.